closing. And so we know that we have a state crisis in front of us with struggling hospitals, predominantly in lower income rural communities in the state of California. And so I would made an also an urgent request, a statewide budget act, which is significant. It's $1.5 billion. It's a lot of money. But this would help assist hospitals across the state that are serving, a high population or a high number of mental health patients who have not recovered, those hospitals that have not recovered from the COVID-19 impact, as well as some of the other challenges with the workforce. One of the challenges that I also learned about the hospital was related to traveling nurses and the impacts and cost of them. And so we want to make sure that this urgent assistance helps keep hospitals open, but also helps us open up the hospital here in Madera. We're also looking at opportunities for my office to work with our community college system. I've been in touch with the chancellor of State Center Community College, because they have a Madera College here in this city, to ensure that we're expanding programs so that we're building the future pipeline of nurses in this community, so that we do not continue to face the challenge with traveling nurses. On top of that, we know we need doctors in our community. For a long time, there have been state legislators that have worked to ensure that we build a medical school here in the valley. There is monies in the budget that have been previously appropriated to bring a medical school to UC Merced. I believe that these challenging times that we're experiencing here in Madera County present a unique opportunity and a remarkable opportunity to have a greater vision. And I will tell you guys that if I had a magic wand today, and what I've been telling folks, what I would like to see is that, yes, we reopen the hospital, but that we rethink about how that hospital's structure is going to look like. They have to look very different. And I also believe that it has to be connected to, or it should be connected to UC Merced's medical school. That we in this community should have a hospital that is a teaching hospital, right? And really helping build that future workforce of doctors in our own community, rather than having to rely on importing physicians, that we are educating and training our local doctors here. And I think Madera Hospital could be that facility. Of course, we would have to work with the board of directors and ensure that we have an entity that could manage that and we can help us reopen that hospital. And the long-term goal being to connect it to the University of California. That would be my vision for it. I am talking to the various stakeholders to make that a reality. It's not going to be easy, but everyone knows in Sacramento, and everyone that has met me, this is my #1 priority as their representative. Madera Hospital has to be reopened, bottom line. And so I'm going to do everything that I can from the state's resources perspective to ensure that we work together, that we have all the stakeholders, and that the community gets to tell us what they want to see, so that we ensure that we reopen a hospital that is truly going to meet the needs, the healthcare needs of not just Maderans, but also the neighboring families that live in the firewalls in Mendota that also use this resource. So thank you for the time to it. It's over 5 minutes, but it was important for me to highlight what I have been doing in the last 2 months to ensure that this hospital will reopen. Again, this is my #1 priority for this legislative session. Thank you.
Thank you, Assembly Member Smoky. I want to have a moment for our panelists. Noelle Burrell, you can raise your hand. She will be giving the signal when you are down to your last minute, just for timekeeping sake. Thank you so much, Assembly Member Scotia. Go ahead and proceed. Thank you.
Okay, thank you. My name is Rob Poitras, and I'm a Madera County Supervisor, as well as a member of the Madera Community Hospital Board of Directors. Now I'd like to give a little background as far as how we got here. Hospital's been around for 51 years. It started in 1971, 72, right in that range. We've been providing acute care hospital services since that time in a 106-bed hospital. we, over the last, from about 2010 to 2020, prior to COVID, the hospital was marginally profitable. If you took a look, if you averaged out the losses and the profits over that 10-year period of time, we were still profitable despite the fact that we were not getting really adequate reimbursements from Medi-Cal for services that we were providing. Unfortunately, they have been not kept up with the rate of inflation. So 2020 comes around and COVID hits, and that's when the spiral began. Our ICU was packed full of patients that we were looking to save their lives. We had a number of nurses that retired because they didn't want to have to deal with it. And that was kind of a nationwide type of a problem.
Little blue, speaker, can I borrow it?
Not, what I would say equitably distributed. The money center hospitals that make lots of money, they
Because I can really hear this, because I'm trying to
university
cook.
giving on
Yeah,
a
this is, I mean, I don't want to put you out.
on your revenues, your profits. And unfortunately, that meant that smaller, less profitable hospitals were not going to get the reimbursements they really needed to deal with the sickest patients. So we had to start hiring traveling nurses. And at the end, before the hospital closed, 40% of our nurses were traveling nurses. And people might say, well, what's the big deal? Well,
You know, your dad, I just don't know how to.
as much as a regular nurse would cost. They were in excess of $200 an hour. So they were making doctors, actually, they weren't making it. The companies that sent them out were making that money. They were making something south of that, but it became a very
Not
problem.
the enormous one.
The bigger one.
Oh, no,
Something
no,
that
that's
we
okay.
had to provide. There's
I heard
certain
you
nursing
speaker, I heard you
ratios
speak
the state
big one.
requires, and if they don't provide that, then we're shut down. We started negotiations with St. Agnes Hospital, probably in December, January of 2022. And those negotiations resulted in a agreement to move forward pending the approval from the Attorney General. Trinity, which is a holding company of St. Agnes, loaned us $15 million to remain operating. They wanted our major debts paid off, and so we did that, and we used the balance of the money to remain operating. In the meantime, they were negotiating, their attorneys and the attorneys for the Attorney General's office were negotiating an agreement to operate that Trinity would operate the hospital. I think he's good. And so during that period of time, we were told know about it. We had to there's a confidentiality clause that required us to not release certain information. And during that time, the negotiations were taking place. So they were moving on and on and on. And then finally, the 11th hour, right when we were really getting down low on cash, it was mid-December. The Attorney General came out with their approval conditions, and Trinity quickly turned them down. So, gotcha. And so that is what the situation was. We did not get a chance. The other thing I was going to mention, we didn't get a chance to look at ways that we could reduce services, because Trinity told us at a particular time during this escrow period that they did not want us to reduce services. The Attorney General's office said the same thing. So after that point, it was we were practically out of cash, and we had to move towards closing the hospital down, because nobody wants to work for a hospital that where they cannot be paid. So with that, I will turn the microphone over to my colleague on the board, Still Manfredi.
Thank you. My name is Phil Manfredi. I'm currently the vice chair of their police department. I've been on the board for about 12 years. Previous to that, I was the chair for 3 years. Karen Paulmelli, our CEO, sends her regrets. She did have a previous engagement with National Public Radio in Fresno with several people that will be broadcasted nationwide. And our chair, David Silva, is currently on the red in LA, which is another previous. I want to thank Madera Coalition for Community and Justice and all the ones to LA. I want to state a couple things before I get into my deal. I will be as transparent as possible in my remarks and any questions. I will attempt to answer any and all questions of where we're going and how we're trying to get there. And most of all, our board and our CEO are committed to one thing and one thing only. That's to get the hospital real. For the last several months, January and February, and Rob, Supervisor Boyd, just covered how we got here. Our MCH staff and board of trustees has been in constant contact with the city and county representatives, senators, State Senator Caballero, Assemblyperson Soria, Congressman Dan Costa, and now Duarte, state public health officials, attorney general, and basically any officials that will listen to us. This is where we're going right now, and this is our path. I'm not going to say it won't change, but these are the three things we're focusing on and spending time, energy, and money on right now. MCH is preparing an initial turnaround plan or startup plan and probably reduce services initially. This will entail a preliminary plan from our hospital staff with the bulk of the turnaround plan developed by a consultant that the Madera County Board of Supervisors has indicated they will fund and coordinate. This will take, we believe, approximately 2 months for that, and hopefully just a couple of weeks to get in some initial turnaround plans to our representatives and the state officials. At the final conclusion of this plan, it will give us the feasibility of Madera Community Hospital starting up again. What is the feasibility of that?
1 minute.
What services can be provided, options, and most important, the initial cost to implement these options. This will require, I want to stress this, because I
Tell me
want to
when.
be as transparent as possible. This will require an amount of funding from several sources. The second thing we're doing, we're continuing soliciting credible hospital organizations to enter into an agreement to obtain and operate Madera Community Hospital. Currently, Madera Community Hospital has entertained 10 to 12 conversations, interviews, some letter of intent for the takeover and operations of MCH. If this is successful, this will materialize with an affiliation agreement between MCH and a hospital organization with the final approval from the California Attorney General. This process will continue concurrently with the development of a startup plan. I want to stress that because we're not doing the startup plan and not doing this. We want whatever works to materialize. We are not bent on any one particular plan or item. The third thing we're doing is we will enter into in bankruptcy shortly. And this action will protect our assets, building, equipment, and provide an alternative method for the hospital organization, for a hospital organization to acquire MCH. Now, this has its pros and it has its negatives. The negatives are every time you sneeze, you have to ask the judge. The pros are a institution out there, hopefully will see in acquiring us at a more favorable type of situation. This process is very tedious, time consuming, and expensive. And the last thing we're doing in our four-pronged approach is we are continuing to support and increase medical rates, specifically for small rural hospitals. The Madera Community Hospital service individuals is this, about approximately 58% Medi-Cal. Medi-Cal does not even pay us to break even. The next is Medicare, it's around 45%. That breaks basically even, and the remainder, 6 to 7, is regular commercial pay like Blue Cross, et cetera, et cetera. So those rates for community, I mean, for rural hospitals has to get up, not only for us, but for all type of rural hospitals throughout the state. Once again, if there's questions of me representing the hospital, I will be as transparent and as forthright as I can. Thank you for this opportunity.
If we just remain ready, I want to remind our panelists that we want to keep it to 5 minutes. We do want to give our community members that are present today an opportunity to ask questions. Community members, if you do have questions, please keep in mind that there are Post-its or there are papers on your table, and we'll have runners to come and pick up your question. Thank you, Willie, proceed.
Good evening again, everyone. I'm Jay Barnum, County Administrative
Want me
Officer.
to start?
Okay.
You're doing.
Thank you. County Sheriff Department. I only have a few things to add. We can go back all the way to the Sunderland story and also to Stell here, who both talked about hospital turnaround plan. Is this better? No, no one's gonna want to use this mic. Just Arnaldo, your health is on his hands. So, with that, we are focused on the money side of things. I did want to mention too, because I don't think Senator Cabello has a representative that was able to be here today. You do? Okay. So they'll probably talk to you about SB 870. On the money side of things, we have two things. The hospital turnaround plan that was mentioned both by Assemblyman Sorla and by Stell is something that we are assisting the hospital with. That item is going in front of the board on March 7th for approval. Once that's in place, then there's a defined time frame somewhere in the range of 60 days for that hospital improvement or turnaround plan to be completed and published. The consultant will be looking at all angles of everything. I'm not going to go back through that because Stell gave that a pretty good once over. The other thing that the county has done previously in January, the county staff brought to the board, and the board determined to set aside, at least for now, $7 million of ARPA funding in anticipation of what the hospital may or may not need. So we have $7 million worth of ARPA projects that will not be going forward until we determine for sure what's going on with the hospital. And one of the reasons why that money is still in our pocket is because as the hospital goes into bankruptcy, the bankruptcy trustee gets to determine what happens to the cash. So certainly we want this money to be used towards healthcare, not towards something else. So we will be moving forward with supporting the plan and with supporting the hospital as needed on a financial basis. Now, in the long run, once the hospital reopened, we will probably be looking at creating a healthcare district 2, which will help supplement some of the money that the hospital or other healthcare organizations are short throughout the year. And healthcare in Madera, we have all of us down here. We go to FCH or we go to Fresno. Everyone in Eastern Madera County, they go straight down 41 to Fresno. So that study or that look into their healthcare needs would be a totally separate study used with a totally separate funding.
Oh, wow.
Thank you very much, Jay. You guys really okay with that? I'm gonna try not to kiss the microphone because Jay just in. My name is Arnaldo Rodriguez. I'm the city manager for the city of Madera. I'm Jay's counterpart at the city. As soon as I found out that the hospital was closing, it was around the same time everyone in this room did. I found out the evening of December the 21st. Since then, the city of Madera has been scrambling because obviously we received a lot of phone calls asking what the city was going to do. That's obviously very challenging because the city is not in the healthcare business. The city of Madera does not own a hospital. We're partners with the hospital in terms of they provide healthcare and we provide public safety and we provide public infrastructure. So the healthcare field for the city is completely foreign, and we were trying to understand how to best partner with the county and all the different country agencies that were in the health in terms of what we can do. Obviously, our emergency personnel is impacted, our firefighters are impacted, our police officers are impacted whenever they go to a call. Historically, we would take them to the Madera community, now we're taking them to Fresno. That takes a lot of resources and that takes our officers' time away from protecting the people in this room. That's obviously very problematic and has a direct impact on all of us.
In terms of the city, when we found out my very first call was actually Assembly Member Sonia, who's at the end of this table. He was the first person I called. He said, hey, did you hear this news? This is not good. Since then, I've been in constant communication with a lot of people in this room, with a lot of the local media, and my counterparts here at the table trying to figure out what to do. I've had a lot of meetings with Jay, my counterpart here to my right, and we talked about exploring establishing a district hospital. The district hospital is probably not the answer, but it's a potential answer or a potential response to try to get a long-term solution for our community. There's a lot of different dynamics that go into it. It's a fluid situation, and it's going to be a long-term plan, and we're going to need a lot of people's help to pull anything off. It's a district hospital or any other type of acute care facility. It's going to be a challenge for all of us, especially when you're a community like ours. For example, the city, we do not have deep pockets. Jay alluded to a few minutes ago, the county has set aside $7 million of ARPA funds, which is called the American Rescue Plan Act. Every government in the country received the money in response to COVID. The city of Madera, we received $23.1 million for that. There was a lot of discussion about what you can do with the money. Our city council and I talked about this in public on multiple occasions, and it was my recommendation to the council that we put 100% of the money, all $23 million, into our sewer and our water systems here at the city. One of the challenges with Madera is our infrastructure is not in the greatest shape, but we put $23 million. I know that there has been discussion as to why the city did not allocate some of those funds to the hospital. Again, we have some of the highest sewer and water rates in this area. And if we didn't do that, your sewer and water rates were gonna be higher. And that's something that we didn't want to do. And so that's what the city put aside for funding. I wish that there was more coming down the pipeline. I'm not confident that that's the situation. But one other thing that we're looking at as recently as this morning, we think we have a temporary plan to try to provide dial-up service into Fresno to the healthcare facilities. So we're looking at Valley Children's Hospital, St. Agnes, and Kaiser Hospital. That's something that we think we can pull off. We've been talking to our partners for that. And we'll more than likely be taking that for discussion from the city council meeting. There's some nuances we still have to work out with insurance. But we're hopeful, and this is car insurance, not healthcare insurance. And so that's something that we'll have figured out in the next couple of weeks. And if that's the case, that's a potential option for community members until we have something more permanent in Madera. So we are potentially going to have dial-up service into the Fresno hospitals. That's not a great scenario. That's probably something that we're looking at that hopefully we can provide for a short period of time as a pilot program. And so with that, I'm going to turn it over to Rob.
Thank you, Ronald. My name is Rockford. I'm the city administrator for the city of South Shore. I've been with the city in that capacity for a little over 4 years and total a little over 9 years. A lot of all of this said are the same issues that we are experiencing in South Shore with our public safety. Our EMS calls that are volunteer fire department has to respond to is not a fivefold. The longer times that the transport is taking for ambulance service, which is in Charlotte, which is just one right now. So all around there's just more demand, puts a lot of strain on the volunteers and also our police department for transport. Takes a lot longer. We have to call in more people because we only have 3 shifts, so we can't have our officers and officers being away for that long. So there's financial impacts. There's everything that's involved with the calls, the vehicles, the fuel, the maintenance, the overtime, everything. We're seeing increased costs across the board. And having that. Also, like on all the addition, we do have ARPA funds, but ARPA funds were roughly around $4 million, and our city council also had chosen to allocate those funds towards water infrastructure improvements, which are much needed and infrastructure as well. So very similar water and sewer, and water. Is included as wells and water tanks and Shalshola. So, and very limited amount of funds that we receive. So I know that in talking with the police chief, there was some on about possibly getting into an agreement between the county and the city of Madera, maybe to have one centralized location for transport. It would be like non-sworn officers that wouldn't cost as much and possibly, save time that way. And then have to come with a whole lot of discussion yet, but I mean, we're talking with my police chief, that was brought up. We're not necessarily able to provide a lot to solve the problem. But we definitely want the hospital back open, and it is very vital to our community as well. And anything that we can do, we're trying to get that done. We shouldn't be willing to do and consider. And we're open to getting options that everybody has, and to assist the county in the way that we can. So, that's really all that I have.
Good evening, I'm Sarah Boss. I'm the Madera County Public Health Director. Many people have asked the question, now that we don't have a hospital, what happens if I have a heart attack? Have you thought of that question yourself? Is that something that's occurred to you? Okay. It does weigh in our minds when we've had this resource that's close by. I do want to explain one really important aspect of emergency medical services, which is contracted through public health in Madera County. We have a regional EMS, Emergency Medical Services Agency, and it's run in Fresno County. They run the 911 call center. So when you call 911, they're the ones that answer the phone, and they are coordinating the response of ambulances across many counties, Madera County, Fresno County, Kings County. That system is built to be able to respond to shortages across those counties. So in addition to our local ambulance providers stepping up and adding additional ambulance service, American Ambulance in Fresno County has also added additional ambulances and stationed them in Madera County. That's how that system is designed, to be able to provide additional services. We all think of that stereotypical, I have a heart attack, what's going to happen to me? If you call 911, I've been monitoring this with our EMS agency. What are the response times? How fast does the ambulance arrive? I know that our law enforcement and fire professionals are also responding, but the ambulances that are really able to provide medical care to you are arriving at the same time as they were before the hospital closed, between 9 and 10 minutes. And I just confirmed that before this meeting started, that is the same response time as it was before. If that ambulance gets to you within that same response time, the time between when the ambulance arrives and when you get to the hospital is that's not the most important time frame. The most important time frame is how fast the ambulance can arrive for something like a heart attack. It really requires urgent response. So we do still have emergency services in Madera County. If you call 911, if you have an emergency, please call 911 and ambulance will respond. The second thing I want to talk about is what we have in our power in Madera County to do as residents with regards to access to care. Because that's what we're here about. We're really concerned about being able to access care when we need care. So there are several things that are available to you, and we have put together a website to help you be able to find these resources quickly. The URL is maderacounty.com/healthcare. There are flyers that look like this that are at the table on the way in. I also have some extras that are in English and Spanish with that website, and you can go there. It can help you quickly find the links to find out if you qualify for Medi-Cal. In California, a lot more people qualify for Medi-Cal now than it used to be. So if you haven't enrolled in Medi-Cal and you qualify, you can do that. That's in your power to do today. Also, you can get set up with a primary healthcare provider. That's your primary doctor who can do screenings, find out what's going on with you and your family right now. Are there any medical conditions that need attention? Because anytime you can identify those early and maybe get on medication or something like that. I'm looking at this sign above here that we're telling all of our young people, change starts with us. We have power in our healthcare to connect with a primary healthcare physician and as much as possible, be able to get to a healthy place before we need to call 911. So I encourage you to do that. There are also on this website, all of the resources that are available from Medi-Cal to help you access care, the transportation services that the Medi-Cal health plans are required to provide. We are especially interested in public health and knowing if the services from Medi-Cal and the health plans are actually working like they are supposed to. We work with the health plans all the time and we hold them accountable. So if you are trying to use the transportation services for Medi-Cal and it's not working, you're not getting to your doctor's appointment on time, I invite you to go to the Madera County website to public health and use our community feedback form. It's on our main page. You can find it there, a link, and tell us what's not working. We really want to hold them accountable. We also want to let you know that if you do not qualify for Medi-Cal, our federally qualified health center, Camarena, offers health services at a sliding fee scale. So we encourage you to connect with a primary healthcare provider and really address any healthcare conditions that you have today to prevent any need to go to the hospital.
Good afternoon, my name is Dr. Mireya Sananeo. I'm a physician and I'm Associate Medical Director at Camarena. Thank you for having us here today. So with the closure of the hospital, as soon as can you hear me? Okay, I'll get those. As soon as the hospital closed, like many in the community, we were very surprised. As soon as that happened, our leadership team at Camarena began meeting and discussing what we needed to do as an organization to step up to help the citizens of Madera. We understood because we serve a lot of patients. And with the closure of the hospital, we had closure of primary care clinics that the hospital had, and specialty clinics. So leadership met and decided that we needed to do something. One of the first things that was done was that we expanded our urgent care hours at our urgent cares. We also increased the number of urgent care providers that were available because we knew that our citizens needed more access to urgent care, especially with the closure of the emergency room and how that happened so quickly. And then we started thinking about what we needed to do to serve those who didn't necessarily need emergency services, but needed primary care services. So we actually set up a phone line specifically for the patients at Madera Community Hospital who needed to now find and establish care with the providers. And that line is still available. One of the other things that we also needed to do, because the specialty clinic that would provide specialty services to so many patients in the county closed. What Camarena ended up doing is we talked to our liaison at HRC, basically the federal government, and we had to apply to open a specialty clinic at Camarena. So what we ended up doing is because that clinic closed, we were able to apply for and get approved to open a clinic that would provide specialty services such as cardiology, infectious disease, nephrology or kidney specialty care, pulmonology. This is a process that usually takes 3 to 6 months, and we were able to get the approval get it into place within a matter of weeks. We have our clinic, on Almond is actually now open, and two of the specialists, infectious disease and pulmonology, have already started seeing patients. And the other, specialties are in the process of getting credentialed. So in the next few weeks, we should have, cardiologists, pulmonologists, gastroenterologists,
She's just responding.
neurologists, excuse me, available there. One of the other things that really affected our patients were, the labor and delivery, services. So we have pregnant patients who are going to the hospital to get their non-stress testing. So testing that they need. With the closure of labor and delivery, we decided within our leadership team that we needed to do something. So again, as quickly as we could, we decided that we were going to offer those non-stress tests at Camarena. We ended up buying the machines and we trained staff in our clinics to be able to operate a clinic and provide the services that were previously provided at the hospital. This helped our patients not have to travel to Fresno to get those same tests done. And one of the other things that we did is the gestational, the Sweet Success program that was offered to pregnant patients who have the gestational diabetes. We needed to continue to provide care in order for these women to have safe deliveries. So again, we decided to meet and we started a program for gestational diabetes. And now at our clinic, not only do we offer the non-stress testing and other OB care, but we also have a physician who is working with our pregnant women who have gestational diabetes to help manage them until the delivery. So this is something that is ongoing. We're continuing to work to try to provide care, not only for the patients we were already taking care of, but also for those patients who were going to the hospital and who depended on the hospital for the care. Christine can speak a little bit more. We're continuing to try to hire more medical providers. We did hire medical providers from MCH. We hired other staff, referral staff, front support staff, medical record staff to continue to provide their care. And then I'll be able to answer more questions after if you guys have any.
Hi, my name is Christine Helen. I'm the Chief Operations Officer of Madera Town Hall. Thank you for the opportunity for us to speak with you today. Some of this may be a little bit redundant, but I'll try to add some new things in here. So as Dr. Samaniego spoke, when Madera Community Hospital closed, there's certain areas that impacted the community. One was the rural health center that was attached to the hospital, and that's where patients go for primary health care, that they were speaking of. Other was the specialty clinic. That's where patients went for nephrology, general surgery, podiatry, infectious disease. Another was the emergency room, what happens for urgent visits. And then obviously the other was inpatient. Camarena Health is an FQHC, so we do not do anything in terms of inpatient services. But what we try to do is to fill that immediate gap in services upon the hospital closure. So as we looked at this approach, it was a three-pronged approach. We added additional providers, not only in Madera, but also Chowchilla, to close the gaps in terms of primary care access issues. The rural health center at the time of closure served about 7,000 patients. So what we were able to do is we were able to work with the managed care plans to ensure that these patients were provided immediate access to services without elapsing coverage or assigned providers. So we were able to absorb those patients and provide access to those patients.
We not only hired additional providers in Chowchilla, but also we hired providers throughout Madera. And like to Dr. Santiago's point, we actually hired providers that were working in the rural health center. We added additional providers to our urgent care to help with urgent care access. This addresses the need for emergency rooms. Although our urgent cares are very different than emergency rooms, there's a lot of patients that will hit the emergency room that could be served in an urgent care setting. So what we did initially is we not only increased the hours of operation, we monitored those, but then we increased our providers. Prior to the hospital closure, we were estimating a certain number of patients. Those patients now, when we're looking at our data, we are seeing an excess of 200% of the patient visits that we had projected prior to the hospital closure. Therefore, it's really evident that what's happening is we are helping bridge that gap and meet some of the needs of urgent visits for our urgent care. We worked with the hospital prior to the closure to make sure that there was a workflow and ease of access to medical records. So when patients were presenting to Camarena Health, they were able to get their medical records easily. During this time, we also ensured that the OD patients were provided extra access during this transition period. We wanted to make sure that our mommies were taken care of and there was no lapse in services there. We also, to Sarah's point, just to ensure that our ambulances had appropriate space, we've made a unutilized space over on Almond available to American Ambulance as well as Pistaretti Ambulance, so they can use it as a staging area for paramedics when providing mutual aid. And lastly, as we talk about displaced workforce, Camarena did conduct a career fair over at Madera Community Hospital. We were able to interview many staff, and we were able to hire providers, billers, medical records, staff who were displaced due to the closure. So that's all I have.
Thank you very much. Thank you, Commissioner. Thank you the people to come here to have an evening with us, listening to our issues. And I strongly encourage everybody to ask questions because we are here to provide you information. We may not have too many solutions here, but just to provide you information. As for the particular concern, my name is Dr. I'm a cardiologist and I've lived in this town most of my life. I won't tell you exactly how many of that there are two kinds of physicians we have. There's a physician very integral to the hospital. If you want to open a hospital back, you have to have physician involvement. Without physicians, you cannot have a hospital. Like without nurses, you cannot have a hospital. There are two kinds of physicians. One who are totally dependent on the hospital. The hospitalists, the anesthesiologists, the emergency room physicians. And unfortunately, we have lost all of them. Because if there's no hospitals, they are moved away. Then there were doctors, and at least 10 of them are available, like sitting here, to show the support, open this hospital. And we are still here. I told my wife that I'm going to move so that you can move yourself. We are not moving. We have lived here 42 years. And this community is very important for us. All my kids were born and raised here. And they went to schools here. And you know, they're at their home. They all moved back to my home. Unfortunately, but that's okay. So I just want to tell you that doctors, we are here, we believe commitment for this town. Some of us have been here many years. And we want to tell you that, patients come to me and say, are you moving? Because there's no, because I next to the hospital. And I look at the, empty parking lot. It looks like the ghost area. And it's very difficult for me to see that. But, but we need 160,000 people over here. It's not only 160,000 here, but the other places I could mention, when those are other places, also come to us. And I'm losing patients. I've lost 2 patients in the last 2 weeks because we have no hospital. It's electrolyte imbalance, we could have fixed it in the emergency room, and we could not fix it. And it hurts us. So I want you to work on it. This is your hospital. I may be here for 5 more years and 2 more years, God knows how many, whatever my wife allows me to do. But it's your hospital. You need to ask questions. You need to ask what happened and what can you do now. As a physician, I'm sure every physician can tell you here, we are going to make our commitments that we are here and we're going to stay here and we're going to do whatever we can. There are things we cannot do. When there's a heart attack, we have to go to the hospital. You have to run back and forth. And that takes time away from our practice. And the number of patients we have is sufficient. This town, this area is short of doctors. And once more time is left for closure of this hospital, more time is hospital stays closed, more doctors will leave. And how are you going to ask for the doctors to move in? I have patients who are leaving Madera. I have a patient today in my office. I was hoping he could come here. I don't know if he's here or not. He moved from Madera to Fresno because there's no hospital. So what's going to happen? This town is going to become a ghost town. If we don't have the hospital. Hospital is very important, especially for people who are a little bit older. Their care is more important. They're not healthy. What can you enjoy? Life is happiness. If there are 3 criteria of happiness, one of them is health. So please ask questions. It's very important you ask, participate. Patients tell me, what can I do? There's nothing you can do. You can do a lot. One lady can get up and make Megan's Law. One lady can get up and have the Amber Alerts. One person can do that. One person can do that. You all can do a lot more. Thank you.
Good afternoon, buenas tardes. I'm Jennifer Hidalgo. I'm a representative with State Senator Ana Caballero. Thank you so much for being here, all of you. I can tell you, as you can see, that this hospital closure is top priority for everybody here. And I know that sometimes it feels like nothing's being done because we don't see it outwardly, but I can tell you, every person at this table, and many of you out there have been working really hard behind the scenes trying to find a solution for this. As we've come to learn, this is a very complicated issue, and Senator Caballero has been working with Assembly Member Sawyer, and she has also convened a group of senators, primarily Senators Grove and Dolly, to form a group to find out what solution. She's been meeting with every type of stakeholder to find out what the best type of solutions could be, both short-term and long-term. Assemblywoman Sawyer mentioned the $1.5 billion emergency ask. From this administration, it's going to be a really big ask, especially because this year's budget is not as robust as last year's. But I can tell you there is something that you can do. And we will be calling on everybody here and everybody in Madera for support. Because once we have this ask and once we have the bills up in committees and up for a vote, it's important to get community participation, because that's how we put pressure on the administration and on other legislators to vote on this and to make sure that the places, the people, specifically Madera County, Madera Community Hospital, get the resources that they need. This is a really big problem. I can tell you statewide, there are 7 other hospitals at risk of bankruptcy or closure for this year alone. Next year, another 7 are in danger. So I can tell you this is not a Madera specific issue, there's a problem, which is what the 1.5 billion emergency dollars would go toward, saving our hospitals. And long-term solutions, Senator Caballeros also has a spot bill looking at reinstating the managed healthcare tax. And I know this, the governor put it in his budget, but Senator Caballero is working with other legislators to make sure that this tax is equitable. Which means that it goes to the communities that need it the most, the hospitals that have the more Medicare patients, and make sure that they're getting their share. Because they're the ones that need it the most, they're the ones that get the least right now, and we need them to get more. So that our hospitals can, stay open and can provide the services to the community. And something she really wanted me to emphasize is that we need to work together. We can talk about what happened, but right now we need to focus on coming together and pushing forward and putting pressure on the administration to make sure that we can get the resources for Madera County and for the hospital that we need. So thank you so much. Thank you for being here and thank you for all of the work that you're putting in your soul and big priority for everybody. Thank you so much. Thank you so much to our panelists for providing that information to our community. Really quickly, before we move on to our Q&A session, I want to recognize a couple of people that are in the room. County Supervisor Leticia Gonzalez, thank you so much for being here. Mayor Santo Garcia, thank you so much. Mayor Pro Tem Elsa Mejia. City Council Member Anita Evans. City Council Members Montez and Dr. Nassar, thank you so much for being here. I'd like to acknowledge something very quickly before we move on to our Q&A session. I think this is really important for transparency's sake. We are going to try to get through as many questions that have been submitted. We are on time constraints. We do have to leave the cafeteria at a specific time. So I just want to let everybody know that we will try to get through as many questions as possible. Please feel free, if your question did not get answered, please remember that we do have an area to add questions or to add comments, and the coalition will take those questions and we'll do our best to get those answers for you. So starting with our first question, I will go ahead and ask the question and then I guess we can identify if it's a general question who can answer. If it is a specific question to a specific person, I'll make sure that I specify that. Our first question is, what are the urgent care extended hours?
That is not it.
So currently, right now, our hours for our almond urgent care are gonna be Monday through Friday, 11 a.m. to 9 p.m. And then Saturday and Sunday, I believe we are now open from 11 a.m. to 8 p.m.
Thank you. Our next question, what is a district hospital?
Thank you.
I don't know for sure that we're trying to do a district hospital here, but hospital district is an area that's decided on by a committee and then by the voters, and then it's supported with a fee or a tax. This is decided on by the voters, and then the district funding go to where that hospital district or healthcare district, depending on how it is put together, is directed towards what the district members want it to be directed towards. In this case, we're talking about Madera Community Hospital. So 100% of if we were already sitting in a healthcare district, and 100% of that money was going to the hospital, then that would be a supplement to the hospital's revenue stream that doesn't depend on patients, it depends on property owners. So you can have a district hospital, a Madera Community Hospital is a private hospital. You want to go online and look at a somewhat similar example in the city of Watsonville this past summer. The Watsonville Hospital combined with the Floreno Valley Healthcare District. It was It required a lot of money from the state and some special legislation, but that may give you an idea of what this hospital is.
Thank you. With the closure of the hospital, how can I help my family member with a mental health crisis, such as anxiety or feeling suicidal?
So if an individual is in a crisis that is truly an emergency and a life-threatening emergency, a mental health emergency qualifies as that, we would encourage you to call 911. So that's very similar. If the individual is experiencing chronic mental health issues or anxiety, then we would encourage you to connect with a primary health care provider, and then they're going to be able to connect you with a mental health provider. If it's a really severe case, then that mental health provider might be at behavioral health services, which is offered through the county, but your primary health care provider is going to be able to direct you to where the best place is for those services.
At Camarina Health, we have over 13 mental health clinicians that are able to serve our community. We also, and that's for mild to moderate. For other needs, we have our telepsychiatry that's in place as well. And that is a higher level of care, but we also provide those services as well.
So if you're not aware, nationally, the mental health crisis line is number 988. That will be answered, it won't be answered by someone here in Madera, but it will be answered that they should be able to help guide your loved one if it's not a severe crisis. If it's a severe crisis, then you should call 911. If the person gets committed on a 5150 hold like in the past, instead of going to FCH, they will be taken to a hospital in Fresno, which may be inconvenient for you or for your loved one, but it's the best we can do right now at this point.
Thank you. Where can we get updates on what is going on with the hospital, such as a reopening?
Well, we have a informational individual that we just reactivated or contracted with. And we can post things where we are, and those big tasks that I mentioned originally are the past we are doing. Any other major items that occur, we'll definitely inform the community.
What can we do as a community in order to help? Or how do we go about asking to reopen the hospital?
Well, representing the hospital is, first of all of you are residents of this state. Like somebody indicated, I think that Senator Cavallera's representative, government works on numbers and people either making phone calls or writing letters or saying we need a hospital in this community. And it will take the city, the county, mainly the state, and possibly the federal government. And we've been in contact with all of them. I think that Madera County residents has gotten the ears of the state and the federal government, not because of just Madera. Madera represents not even 4/10 of 1% of the state population. But this is not just a Madera problem. This is a state problem. And out of 40 million people, I believe it affects approximately 12 to 15 million. Because the hospitals that are being injured in the aspect of not being able to pay their bills and move on are Medi-Cal hospitals. The hospitals in Palo Alto and in areas along the coast don't have, San Francisco don't have this problem in general.
In terms of reopening the hospital, what is a practical estimate?
If I were just to, and I can say I don't know, and I don't specifically, but I see no, unless a suitable hospital or entity says, we will start negotiating with you right now to reopen and to affiliate, which is fancy word to take over. To get through the process, it would be light years would be 6 months and most probably a year. If you go to a district or anything like that, or anything very tenuous, you're talking a year and a half to 2. This will not be open in a month or 2 or 3.
As board members, were there any warning signs that could help us prepare for us to not be in this situation?
The short answer is yes. We are a small 106 bed hospital with no big donors and not a tax rate. And basically those payer mixes is Medi-Cal about 45 to 48%, Medicare about 45, private pay about 6 and 1 or so percent the state jails. And we, as a hospital board, and some of the doctors out there have been on the board, Mr. Freitas has, and Dr. Ashcroft has, and several doctors there. And we recognized a year or so ago that affiliation with another institution was most probable in the benefit of this community. And we started working on this. We just didn't start working on, we started working on this over a year or so ago. 2 hospitals were interested in us, 2 basic hospitals, Special Community and St. Agnes, which is owned by Trinity. And we pursued both of those. And the bottom line is it's very difficult for a standalone hospital. It can be done, but it's very difficult for a small standalone hospital. Now, anything's possible. But it's going to take some startup money. And that's why we originally decided we should affiliate or be taken over by another institution.
Why did NCH fail to apply for FEMA relief funds?
We didn't fail. We have that in the process right now. We have an individual, contract individual working on it. We spent our entire reserve, somewhere around 16 or 18 million, I don't know exactly, on COVID and all the necessary things. And we did apply for the FEMA funds. We asked the county, we asked the city. I'm not here to bash anybody. They had their own ideas and own things, and we got out of spending about, and I don't have it right in my head, but out of spending approximately $24-25 million in our reserves, which wiped us out. We got about 10 or 12, didn't say, money in reserve, money reimbursed, and we still have claims in that we'll get over the next year to 24 months.
What is the name of the page to stay up to date with information? What is the name of the page to stay up to date with information?
We haven't posted anything right now. We just, like I indicated, rehired our contract, an informational officer to get that out so we can do week-to-week things and that type of stuff, and we will post that in the immediate future, next week or so.
Has county hospital advised insurance partners contracts about the closure?
Yes, we have.
Is there a grant writer for Madera at the hospital?
We do not have a grant writer. I can't speak for the city or the county.
How many of you support a single payer health system?
I just want to let you know, this county does have a grant writer. And going back to the previous question, if we can carry that, and our money, we give the hospital $1.4 million.
Thank you.
Excuse me, on behalf of the city of Madera, we have 3 grant writers on staff. Our grant writers focus on city grants, specifically housing grants, community block development grants, and transit for our bus system. Our bus system in the city runs 100% on grants, and that's primarily on focus. And then we also receive other grants for parks, for open space. We recently issued a grant for $2 million for a brand new park on Olive Knox. We also received $800,000 for the president. So we do have to be grant writers at the city.
Thank you. What is the major source of money to keep a hospital open besides the MCH?
Our major sources is we do not have a tax base, like I indicated. We get very little philanthropy. I mean, we get some, but it's not very much compared to big institutions and foundations. But our major funding is Medi-Cal, Medicare, private pay, and we have things like provider fee for disproportionate hospitals that don't necessarily get the type of funds. The state has all the hospitals in the state pay, and let's say each hospital pays X number of $1 million. Then they take a little away from everybody and then reapportion it back to the disproportionate hospitals that are theoretically less advantaged or poorer. And we are in that program and get money throughout the year for that.
If they claim it being the Madera Community Hospital closed, did I skip somebody? I'm sorry, I don't want to cut anyone off. Forget. If they claim it closed, Madera Community Hospital closed abruptly and before filing bankruptcy because money wasn't coming in, why didn't they inform us before or proactively care for patients?
That's an excellent question. We operated for the last year between the Attorney General, Trinity, who owns the parent company of St. Agnes and Madera Community Hospital. Nobody, single individual, I'm not going to blame anybody, I'm not going to badmouth anybody. It took the better part of the year, 9 or 10 months. We all operated on the aspect that this would go through. This would go through to the very end. During the middle of the process, the board of directors had an important meeting that decided what services we would cut out so we could live to fight another day, another year, so. Both the Attorney General and Trinity said, don't cut that service, don't cut that service. This is going to happen. And it takes too long and too hard to get that license reactivated and etc. And so we looked at our partners and we said, well, we won't cut anything, although the board seriously considered it. In addition to that, around July or thereabout, we knew we were going to have a cash flow. We were spending COVID, testing, inoculations, door monitors, equipment, everything. We knew we were going to have a problem. We told Trinity that we needed some cash. They lent us, and I use the word lent, this was not given. They lent us $15 million with the directions that we will pay a $5 million loan off because we want to be the holder of that note. You will finish some projects that you're doing because when we take over, we want that clinic and that lab and that stuff done. And then if you need some more money to keep going, you can use the last $5 million for operations, maintenance, staff, nurses, etc. And we did. And we did it diligently. And then December came and we were out of money by the end of December and we had to shut down. We could not pay employees. That's why we had to shut down with a sudden notice because we couldn't get this deal through.
Thank you. I'd like to acknowledge the following questions are coming from our Zoom chat. How much money is being used as of now to keep licenses and insurance for hospitals?
Well, we are spending, we have maintained our license, we have it in suspense, so hopefully we can talk the state into keeping that. And in suspense, and we don't lose it. We have it, I believe, now for approximately 6 months and various licenses. What else was the question?
It also asks regarding insurance for hospitals.
We have insurance for our building, fire, all that type of stuff. We have liability and et cetera, and that is due in June, and we're gonna renew it for the remainder of how long it takes.
Thank you. Our next question is, what happened to all of the PTO money that is still owed to all the people that got laid off?
Thank you. PTO is a personal time off, vacations, birthday, et cetera. We owe the employees approximately $2 million. That will go into bankruptcy. They're relatively high on the chain. I am sitting here embarrassed, ashamed, and hurting that we could not pay it. But we couldn't pay the power bill if any money we had left, we had to keep to continue the fight of what we're doing. And if we don't heat that building or secure it or have people to do the accounts receivable and the security, we won't have a building. And the day we lose that building, what we're trying to do is support as the county, as in the city, keep the integrity of that land, that equipment, and that building alive. If we lose that building, our children won't see a hospital. I mean, our grandchildren.
What short-term emergency plans are in place to provide Medi-Cal recipients who use MCH Family Clinic for care support to transition their care?
The Medi-Cal support services that are available, we have them linked on the website. So this is that flyer I was telling you about. We encourage you to take a look there. The first thing that you can do is you can use the nurse advice line or the Medi-Cal health plan hotline to be able to identify what services you need and how those can be linked to that. So we encourage you to use that website and resources to be able to identify those. Also Carolina Health also has insurance enrollment specialists that are available to the community. You can make an appointment, they're easily and readily accessible. They will look at your income and they will try to match you with appropriate programs, be it Medi-Cal, Medicare, family packs, cancer detection programs. Medi-Cal for your children. We do have them in several locations throughout Madera as well as Fertila to help ensure that you do not have any lapse in insurance coverage, or if you're uninsured, you're able to get insured. So we'll do the heavy lifting for you to be able to identify those programs that you and your family are eligible for.
It is my understanding that the hospital owes a large amount of money, and that is preventing other companies from taking over. Why can't the hospital file for bankruptcy? It says why can't, but why didn't they?
We didn't file for bankruptcy until, well, we aren't filing for bankruptcy, we haven't filed yet. And it's probably right around the corner. But obviously, until the very end, we did not know the conditions of the Attorney General, and we did not know exactly what Trinity was going to do when that occurred. When the conditions were issued in November, or thereabouts, and in November, it took Trinity about a week or thereabouts to say, we don't accept them, we're out of this plan. And we then backtracked to several hospitals, and we say, would you take up the baton, the ball? The answer was no, no, and then no. And so we are in the midst and preparing. You don't file the bankruptcy and go down and say, we're filing the bankruptcy. It takes a lot of work for our staff, our attorney, et cetera. We've been closed now since the day we closed, because we didn't know we were gonna do this until January 3rd. And so here it's March 3rd or 2nd or whatever, and that will be most likely coming shortly to protect, like I indicated, all the assets we have. And we believe we can address our, and I say this in general, that we can address all of our liabilities as we go down to bankruptcy.
Who looks over the budget of the hospital and how often?
We had a chief fiscal officer who'd been there 18, 19 years. He has since retired as of December. He looks audit at the daily budget, et cetera. The finance committee, which I am a part of, and so is Mr. Poitras. I believe there may be some others in this room that are on it. Looks at it probably on a week or every other week basis. And then our full board looks at it once a month.
If we would get out of state awareness of this situation, would this affect the state and community cash flow and taxes negatively?
Say it again.
Sure. If we would get out of state awareness for this current situation, would this affect the state? I'm sorry, would this affect community cash flow and taxes negatively?
No, I don't think this has anything to do with taxes or anything that, or a negative. Obviously, when you have a hospital closed, it's not a positive thing. Obviously, and this is an economic question, our economic director here, but obviously, you know, when you lose something as important as possible, that's not a positive thing. You don't put that on your resume, hey, you lost the hospital. So that's a negative effect, but I don't think it affects taxes or any type of stuff or et cetera. The only way it would affect taxes is if John Doe Company was going to come here, and one of the reasons they didn't come here is because the hospital is here.
Urgent care cannot do x-rays on the weekends, so it's a burden for patients and overload professional hospitals. What are the alternatives?
We don't know who should take that.
That's the alternative.
So I was wondering that, a significant barrier is to be able to get, technicians, x-ray technicians. That is a pain point in trying to hire them. It is very, very difficult, here in the valley. So I know that, Camarena Health is looking at ways to, start a program to train through our own internal efforts to create the pipeline. I do know right now we refer over to our local imaging here in Madera for x-rays.
We do have it's something called Madera MRI in Madera, which is open from Monday to Friday. They're not open on Saturday and Sunday. They do MRIs, they do chest x-rays, they do the ultrasound. The CT scan is not ready. I went to visit them. They're not ready for the CT scan yet, but hopefully that will be soon ready. And they're quite busy in open hours.
As we get to close out the Q&A session, the last question for the evening is, in terms of Camarena services, can we get a brief overview of what is now provided at Camarena now that MCH has been closed?
Yes, we do. So we offer a wide variety of services. So medical, when we start medical, we have family practice, we have a pediatrics clinic, we have internal medicine. We have our specialty clinic that we're starting to work on. So we'll be offering the different specialties that we talk about. We offer women's health and prenatal care. We do have contracted OBs, we deliver our babies. We offer the services for the pregnant women with gestation and diabetes. We offer mental health services, so we have behavioral health counselors, clinicians, at almost every single clinic that we have. We have telepsych services, so if a patient has a mental health condition that is severe enough that they need telepsychiatry, then there's that availability. We have dental clinics in Madera, in Chowchilla, up in the mountain community. We have optometry and ophthalmology, so patients are able to get their routine eye exams and Madera and in Chowchilla. We have the ophthalmologists, which are eye specialist surgeons through our Insight clinic, and for the more complicated patients, we refer there. We have dental services, so we have dentists. Sorry. We have health educators on site, case managers who work with our patients. So we have a chiropractor who offers services. We have a wide variety of services, not only within the city of Madera, but in Chowchilla and up in the north.
I know that there was a question just in terms of Medi-Cal. Camarena last year in 2022 served over 60,000 patients. Roughly about 65% of those were Medi-Cal patients. So we do contract with the managed care plans, Anthem, as well as Calviva. It's Medicare as well. We have Medicare Advantage as well as straight Medicare. We are able to see private insurance, self-pay, and then we do have as an FQHC, a sliding fee scale. So if you're uninsured, you're able to apply for our sliding fee scale program. And based on your income and the number of dependents, we can put you on a slide where you have access to all services. So we really pride ourselves in ensuring that we provide access regardless of payer, to ensure that we meet the community needs. And that's what we're here for the safety net for Madera County residents, to ensure that all services are accessible. Thank you. I want to acknowledge that we're going to take one more question from Zoom and one more question from the audience. From Zoom, is the hospital CEO still being paid when there is no money?
The short answer is yes, and I'm an editorial. I'm an editorial. And two of the bosses are right here. Look at one. There is money, and money's coming in periodically from our provider fees, from our Medi-Cal and our insurances, and it will be coming in over the next 24 months. And the short answer is she is getting paid, and everybody that is still there, out of 750 employees, is about 30. And there was something in the print today, and I'll just reiterate. When you close down an organization, there is an accounts receivable section that we have to maintain, so people can they can collect the bills and the insurances that are coming in. There's an IT section, which is informational technology, so the computers and stuff will work. And all those are reduced staff, obviously. There is records that we are getting out, maintaining and getting to people. There are a couple people in administration, security. If you do imagine if we did not secure that building and it was vandalized or put on fire or whatever, and maintenance. You can't leave a building like that and not heat it, cool it, and make sure it does not deteriorate. And those are what the 30-some people are doing.
Our last and final question. Accidents and births do not stop at 8 or 9 p.m. So what 24-hour services are offered in Madera?
The primary service that's 24 hours is our emergency services, so that if you do not have transportation to get to the emergency room for labor and delivery or something like that, and call 911 and access an ambulance.
I want to take this opportunity to thank our panelists for the information and answering our questions. The questions that we do have left over, we will do our best to receive an answer. Those will go out on our social medias as far as providing the information to the community. As we begin to wrap up, I wanted to introduce Alden Roy from California Rural Legal Assistance. He's worked tirelessly on this event supporting the Madera Coalition, and he would like to share a few words with our community members here in the building.
I add to what the vet said, actually goes out additionally, all of you came here to see major time to be here, obviously. What I want to be able to remind you is that when you lose an institution that's been around for 50 years, people are really feel the loss, and people are saddened. Some people are hurt. Some people are bitter. Those are real feelings. There's a saying that if you're not part of the solution, then you become part of the problem. And I really want to go back to 2 years ago when we were hit with the pandemic. And the hospital and the health department were really the beacons of light in this community. And myself, I would say, all of us. I say that because even in grief, we have to move forward. And if we do the same thing as a community that we did during the pandemic, where we came together, we did things that we never thought that we would do. We did things that we thought it was impossible to do, but we did it. But we came together as a community. We came out of the pandemic as well as any other community. But we need to go back to that same resolve, that same commitment, with that same energy. And this is where you come in, that if you stay involved, stay engaged, it's something will come out of this. I don't know all the options, but it doesn't end tonight in terms of coalition putting on community meetings. The next one we have planned, we're going to invite a woman who's really one of the key people that turned the Watsonville hospital into a district hospital. She has agreed to appear on Zoom because she's in Watsonville. That's one coming in, whatever. So there's going to be a second workshop that we're going to put on as this thing kind of continues on. So one of the things I want to stay engaged kind of stay in touch. It says here, and so you know all the coalition's social media, the coalition, updating it all the time. And there's some comments that I will put up, maybe that out, whatever. So let me thank you again. Thank you for coming. Thank you for caring. Have a nice evening. There's some extra chicken, so we're gonna have enough.
Grab us some, like.
These